Hello and welcome to the 57th Bi-Monthly Breastfeeding Coalitions webinar. I'm Kinkini Banerjee, the Senior Manager of Coalitions Relations at USBC, and it's wonderful to have you join us today. As you know, this series is jointly hosted by CDC's Division of Nutrition, Physical Activity and Obesity and by USBC, and it's held every other month. And we lovingly call it the 222 because they're held on the second month on the second Tuesday of the month. And the purpose of this call is to talk about all the different breastfeeding projects that are happening around the country. So we have state and local coalitions present one time, and then we also have our national member organizations who are involved in breastfeeding intervention projects share their highlights as well. All these webinars are free, and the access is open to any breastfeeding advocate around the country. So we have our topic and speaker details are usually posted about a week or 2 weeks before the sessions, and then they are also posted on the Coalition's Learning Connection. So if you aren't on any of these, we would urge you to join our Learning Connections to get the news about not just this series, but a lot of our other series, webinar series. So the good news is that last year we streamlined access, and we have these webinars set up as a series. So earlier you used to have to register for each individual webinar. Now if you're registered for the 222 series, you'll automatically get the reminders, and all the other announcements that go with it. So to find archives of our past session, as I said, all of these sessions are recorded. So you can, we know that not many of you can join live, but if you want to go and access our recordings, you can go to the webinar page. And here's how you do it. On our website, as you look across the tabs, the last tab is Coalitions. Click on that and you'll see, as you scroll down, you'll see our different webinar series. The CDC-USBC bi-monthly webinars are the 222 series. So if you click on that, it'll take you to the page with the handouts, the video recordings, or any other ancillary related materials that we post. So we have a lot of attendees for today's session, so welcome. And during this session, the attendees are in listen-only mode, but we encourage you to ask questions. And so you can use the question function to type in your questions at any time during the webinar. We'll set aside about 15 minutes at the end of our presenters' session to do Q&A, but you can send in your questions at any time. So you can type your questions into the box, and as you see, you should see a control panel on the right of your screen. If you don't see it, it might be minimized. Just click on that orange tab and it'll pop back out, and scroll down, and just under the audio button is the questions button. Click on that and it'll open up a text box for you to type in your questions. So go ahead and be sure to get all your questions answered today. And during this session, if you have any technical problems or audio problems, send an email to coalitions@usbreastfeeding.org, and our staff will be able to help you. So we will not be having any regional calls today. So after this session, this is our one-hour session today, and that brings me to today's topic, Maryland's journey to becoming bag-free. So as you know, the Surgeon General's call to action, Action 6, states that ensure that the marketing of infant formula is conducted in a way that minimizes its negative impacts on exclusive breastfeeding. And we know that some of the implementation strategies are that hold marketers of infant formula accountable, take steps to ensure that health claims about formula are truthful, and ensure that healthcare clinicians do not serve as advertisers for infant formula. But the reality is that in the US, the majority of birthing hospitals distribute industry-sponsored samples of formula to new mothers after they give birth. Women receive formula samples in hospitals, are less likely to breastfeed exclusively, and much more likely to breastfeed for shorter durations. Today's session is about Maryland's journey. As of October of 2015, 33, all of Maryland's birthing hospitals ceased distribution of infant formula, making Maryland a bag-free state. This journey took tenacity, persistence, and a great deal of advocacy, and we are very glad that we have Dr. Dana Silver talk to us about the 8-year journey to accomplish this feat. So I am delighted to introduce Dana Silver. Dr. Silver is a general pediatrician and associate director of Green Spring Pediatric Associates, the outpatient department of the Herman and Walter Samuelson Children's Hospital at Sinai in Baltimore. She is the clinical assistant professor of pediatrics at the University of Maryland School of Medicine. Dr. Silver's interest within the field of general pediatrics spans a diverse areas, including breastfeeding, learning and behavior problems in children. She co-authored the 2010 AAP book, Guide to Learning Disabilities for Primary Care, and I know many of you are familiar with this book. In terms of breastfeeding, she has lectured extensively across the Mid-Atlantic region and has worked on advocacy and legislative issues, including the use of donor human milk in Maryland's NICUs and insurance coverage of breast pump. Dr. Silver recently developed and recorded 3 hours of CME webinars for physicians at hospitals preparing to go baby-friendly through the lactation education resources. She serves currently as vice president of the Maryland Breastfeeding Coalition and breastfeeding coordinator for the Maryland chapter of the American Academy of Pediatrics. And for those of you who know, Maryland Breastfeeding Coalition is a very high impact, high performing coalition, and Dr. Silver is one of their most active star members and has done so much for breastfeeding. Not just for her state, but across the region and in the country. In 2013, she received the honor of being named a fellow of the American Academy of Breastfeeding Medicine. And in 2014, the Maryland chapter of the AAP named her Pediatrician of the Year. So with that, I'm going to turn it over to Dana. Welcome, Dana.
I just had to unmute. Hi, thank you so much for that introduction. Let me pull up my slides. Can everybody see on the screen my slides?
Not yet, Dana. Do you have to show your screen? Do you see a little button that says?
That's the thing I think I forgot. Okay, so show my screen. There we go. All right, is it up now?
Not yet.
I did the show my screen. There's always that transition problem. Let's see.
Yep, we see it now.
See it now? Okay, so let me put this down and put it in slideshow mode. Hello, everybody. I've not done one of these webinars before, so hopefully I'll get the hang of it. I am going to talk about how we became bag-free in Maryland, and it was a long and drawn-out experience. So I'm going to start with talking about one hospital's experience. Back in the 1990s, we had a really fabulous lactation consultant who really wanted us to ban the bags, and went to the hospital auxiliary, got a grant to get bags to replace the formula discharge bags. They were very well received, but it was a 1-year grant and it was not renewed, citing the costs. So we went back to the formula discharge bags. And she continued to encourage us looking for ways to ban the bags in our hospital. And one of the neonatologists also took up the cause. She went as far as going to the hospital ethics committee, saying this is free advertising and unethical, but they didn't really agree with that and did not pursue it beyond that. Back in 2010, the Department of Pediatrics agreed that we should not have these discharge bags, but the Departments of Obstetrics and Nursing said, no, it's too expensive, we can't do this. So, excuse me, that's one example of how the formula companies have just kind of wormed their way in, and we believe we can't do without them. So for me, the seed was planted back, I'm pretty sure it was a 2008 USBC meeting, and I heard Melissa Bartik talk about ban the bags, and the way she said, the only way to sell more formula is to sell less breastfeeding. Excuse me. So that really got me thinking. And so I gave lectures across the state and across the region. I give grand rounds and other types of talks. And so I started including a couple of slides in my talks just to plant the seed in other places. So including this slide with the fabulous graphic from the Massachusetts Breastfeeding Coalition, talking about how hospitals should be marketing health and nothing else. They shouldn't be marketing baby formula. And I cited different studies, the Cochrane Review, that have all shown that association between free commercial formula discharge bags and decreased breastfeeding. And I would give specific examples about those studies. And we all know that women who receive these bags are less likely to initiate breastfeeding, less likely to continue breastfeeding, and that the median duration of exclusive breastfeeding is also down. And early supplementation leads to early cessation of breastfeeding. And again, in these slides that I would give in my talks, I would talk about how these discharge bags imply that the hospital is endorsing a particular formula, a particular brand, and that marketing formula undermines the choice by setting moms up to breastfeeding failure. So the formula companies say it's freedom of choice, and again, as Melissa Bartik said, the only way to sell more formula is to sell less breastfeeding. So now I'm going to give a more positive case example. So Upper Chesapeake Hospital, which recently became University of Maryland Upper Chesapeake Medical Center, is about 45 minutes north of Baltimore, and it's a suburban rural community. There aren't a lot of hospitals around there, so but there are a couple, and so they really wanted to market their hospital. So they had opened up their family birthplace, and they had a fabulous lactation consultant. Her name is Lori Mealy. She has since moved, but she's there, and she wanted the hospital to go baby friendly and wanted the hospital to become bag free. So these are some of her slides, and she gave us some feedback about what steps she took. So the way she approached it was a couple of things. First, she needed to get buy-in from the administration. So she approached the nurse manager. She brought evidence-based information from banthebags.org, and for those who haven't looked, there's lots of good resources there. She focused on marketing their birthplace to the community, and she highlighted the cost to families of $700 more per year from brand name formulas versus less expensive generic brands. And the other thing she did, which I thought was really good, was she worked to get WIC to come into the hospital to enroll patients early, because a lot of patients are very worried that, well, if breastfeeding doesn't work, or if I'm bottle feeding, I need some formula to take home. And if they're low income, that is an added cost. And again, with that, it is an added cost, and people just assume that they're going to be given lots of free formula. We do need to help moms in advance. Just say, like, you're going to be buying diapers. If you plan to formula feed, then you need to be purchasing some formula in advance. The next thing she did was getting acceptance from the staff. So she really needed to get buy-in from that. So she had a staff contest to design and approve the logo, the color, the bag. They got some funding from their marketing department, and then every hospital has those infant photo companies that come in and take pictures of the babies in the hospital, and they give money to the hospital. So she was able to get the money from the infant photo companies also to help pay for the bags. And then she worked with the purchasing department to stop contract with the formula companies for their gift bags. Again, with a committee and working with marketing, they decided what needed to go inside the bag. So their bag had the nice family birthplace logo on the front. And I'm pretty sure they also did a car window shade with a hospital logo, one of those you put on the car windows to block the sun for the babies. And again, great free advertising for the hospital. And then she prepared a slideshow, and these are some of the slides from her initiative, from her rollout. So she talked about within the next several weeks, we're going to be implementing this, and we're not going to be giving the formula company bags. Why no more formula bags? She talked about how our mission is to promote health in our community, and marketing a product that can potentially undermine the health of our patients is a conflict of interest. She gave examples on other slides that I'm not including here, but talked about breastfeeding as the gold standard. And again, she needed to get buy-in from the staff. She talked about formula being regulated by the FDA, and that store brand formula or more expensive designer brand formulas have the same nutritional value, and yet those designer brand formulas cost $700 more a year. And again, trying to get people really interested in this. We know our team members are the best healthcare product any mom or baby need. Let's market the best. Let's market ourselves. And I thought this was fabulous. And really, the people up, the employees up there were all really into it. So that's a really great experience. That was back in 2010. So she was one of the earliest that got something going in the state. And over time, as you all know, other states began to go bag-free. So Rhode Island in December of 2011, Massachusetts in July of 2012, and then I'm jumping ahead and I'm going to go back in time to talk more about what we were doing. But Washington, D.C., if anybody's on the line, I know you don't count as a state, but I want to acknowledge that you all went bag-free with your 8 birthing hospitals in August of 2014, and then Delaware beat us by a few months in July of 2015. So meanwhile, in Maryland, as was mentioned, I am the breastfeeding coordinator for the Maryland chapter of the American Academy of Pediatrics. So in addition to my lectures, I started writing newsletter articles. So in this one, I talked about last week 2 boxes of Similac formula along with special welcome packs, nice bag, formula coupons arrived at my office without a request. And in my office, they often will just show up, and it's so frustrating whether we tell them not to. There may be a well-meaning nurse or someone who says, oh, sure, you can come. We're also attached, there's an OB office, we're a community health center, there's an OB office right above us, and they get the same things. And then in my newsletter article, I talked about the free discharge bags in the hospital, and I said, so what's the big deal? Does it really affect breastfeeding rates? And of course, it does, and I went on to talk about that. At that point in April of 2011, only Upper Chesapeake and Johns Hopkins were the 2 hospitals to go bag-free. And both of those hospitals were working toward baby-friendly at the time. And then in 2012, Public Citizen launched their fabulous campaign to get rid of the commercial infant formula discharge bags and marketing to hospitals. And if any of you have not seen it, you certainly should go to their website. I really do recommend it. They have lots of resources, just like Ban the Bags, with a slightly different bent. So in one of their statements, they said, commercial infant formula is readily available to these women and their families. We're not trying to eliminate the product, nor are we passing judgment on women who cannot or choose not to breastfeed. But the vast majority of women enter the hospital intending to breastfeed. In order to support these mothers, we believe healthcare facilities must provide adequate support, which includes removing formula marketing from their premises. This is something that will come up later on. Their point is that we're not passing judgment on women who cannot or choose not to breastfeed, but as you'll see later on, people still assume that we are. So back to the Maryland AAP, I wrote, following that, another newsletter article. I cited Public Citizen's campaign. I cited the 2011 Surgeon General's call to action. And by fall of 2011, so about a year and a half later, from the first newsletter article, there were 6 hospitals who had banned the bags. Johns Hopkins, Upper Chesapeake, several others. Most of these were working toward baby-friendly. The thing that really got the ball rolling in Maryland is that our Department of Health and Mental Hygiene, which is our Health and Human Services equivalent, launched their model hospital breastfeeding policy in November of 2012. And we at the Maryland Breastfeeding Coalition were involved with that, and we do have members of our coalition who work for DHMH and Maryland WIC. And so DHMH encouraged all birthing hospitals in the state to become Maryland Best Practices hospitals by either attaining baby-friendly certification or by meeting the 10 criteria contained in their policy recommendations. The secretary of DHMH in Maryland at the time was Josh Sharfstein, who is a pediatrician and a big supporter of breastfeeding, so that certainly helped. So the way they developed this is they had a stakeholders meeting in December of 2011. I was there, lots of physicians, different hospital representatives, hospital administrators. people, lactation consultants, and anyone else that DHMH thought would be a stakeholder. They wrote the draft, and they shared it for public commentary and finalized it and launched it finally in November of 2012. And it's based on the 10 steps to Baby Friendly. It doesn't have the inspection and other things that Baby Friendly has. Like Baby Friendly, step 8 is give breastfed infants no food or drink other than breast milk unless medically indicated. And that means don't accept free formula advertisements or formula coupons for use in the hospital or distribution to breastfeeding mothers. So we at Maryland Breastfeeding Coalition were waiting for this, and we had gathered many different things. And over the winter of 2012 into 2013, we launched our campaign. So this is our web page. Now this is our current web page. Back then we had different things on there, but again, on our web page it talked about what is the campaign. It explained why it's important and why we support it. It listed the hospitals that had banned the bag. It provided resources, including the banthebags.org and others. We also put together a PowerPoint presentation that we recorded and placed up on YouTube, which was viewed, I don't know how many, it says 575 views. I don't know who actually saw it besides us, but I'd like to think that hospitals did. And I'll tell you how we publicized that. And it was about a 10-minute PowerPoint that, again, reviewed the data, talked about why it's important, and talked about ways that they can get it done. The other thing we did is we sent letters to the Maryland hospitals. So the first letters were in November of 2012, and that was sent by me and a neonatologist who was also a member of the Maryland chapter of the American Academy of Pediatrics. So it was on Maryland AAP letterhead. And I sent that out to the chairs of pediatrics and OB and the directors of mother-baby nursing. And then the other was sent from the Maryland Breastfeeding Coalition, and again sent to pediatrics, OB, directors of mother-baby nursing, and this time we included the CEOs. With it, we cited the DHMH model hospital breastfeeding policy. We gave lots of resources. We gave links to this PowerPoint video. We offered to provide any service possible to help them and encourage them to ban the bags. In our letters, we gave some specific examples of how hospitals in Maryland had done it. So we talked about Upper Chesapeake, and we talked about Shady Grove Adventist Hospital, which was our first baby-friendly hospital. How they worked with marketing to design and distribute their own discharge gifts, which advertised their hospitals. We talked about Hopkins, how they stopped giving out formula samples as part of a hospital-wide effort to stymie the marketing of pharmaceuticals within its facilities. And the hospital administration chose not to give out a replacement bag. We talked about Memorial Hospital at Easton, which is a small hospital in Eastern Shore, how they discontinued distribution at the behest of risk management, which I thought was really interesting, upon investigating their liability in the event of a formula recall or a baby getting sick from expired or contaminated milk. So that whole risk management was a whole new approach. There were some other programs that have also used ethics. Again, we talked already about kind of, formula companies are basically pharmaceutical companies, and hospitals are acting as marketing conduits and agents for formula manufacturers. And the other approach was corporate compliance. Is the relationship between the hospital and formula companies in compliance with rules that other departments follow in terms of corporate compliance. So we tried to come at it from a bunch of different ways, and we also cited the fact that those hospitals that stopped giving away formula discharge bags and didn't make a replacement, that really there was no flack from patients, that nobody really complained about it, and the few that asked and said, hey, where's my bag, they were given an 800 number to call and get their own free bag. Honestly, most people get nice diaper bags or whatever as gifts when a baby's born, so really, surprisingly, these weren't missed. In the letter, we also said your hospital aims to promote the health of infants and mothers, but when providing the bag and/or formula samples, the ongoing promotion of infant formula sends the inaccurate message that these products are medically approved, endorsed, and necessary. So the momentum started building, and we started getting really excited. My hospital, which was that first hospital I mentioned, took just one administrator. After all these years, all it took was one administrator to say, oh, we're going to do the DHMH model hospital breastfeeding policy. This is an easy thing to do, and poof, it was done within a month. I was just floored. Other hospitals also saw this as low-hanging fruit and said, you know, this is an easy way to get started on this policy. And as I said, most hospitals simply discontinued the bags without replacements. By August of 2013, so 2.5 years ago, all 32, I had said 33, but I'll explain why it actually ended up being 32. All 32 of Maryland's birthing hospitals committed to the DHMH program, 9 committed to working toward baby-friendly, and 23 committed to following the Maryland Hospital Breastfeeding Policy recommendations. Since then, we've had several other hospitals that have started working on baby-friendly status thanks to the NICHQ and Empowerment grants, so it's really fabulous. And we now have 3 hospitals in Maryland that are baby-friendly, Hopkins, Franklin Square, Shady Grove, and we have 2 that have had their inspections and are very close. So it's really amazing how things have changed in just a few years. What has also encouraged hospitals to keep going is that DHMH has sent periodic assessments, so surveys out to the hospitals since the launch, and has hosted sharing webinars and conference calls to talk about not just ban the bag, but all the other different steps in the policy statement. And the assessments asked the hospitals to identify the steps they were meeting and to share their experiences and to give any impediments to achieving other steps. So it was that kind of reminder and that constant nudging. So over the next 2 years, we continued to follow up. And we really did dog these people, is that periodically we would poll and tally the hospitals. And the way we would do it is sometimes we'd identify contacts at the hospital. Sometimes we'd just cold call. So I would, for example, call up a hospital's mother-baby unit and just say, I wouldn't tell them who I was. And I would just say, hey, you know, I'm just curious, do you all, you know, those formula discharge bags, do you all give them out? And I never had anybody say, who are you, or whatever. I would just get honest answers. And so slowly, we whittled the numbers down. I would email hospital administrators. I'd email, as a pediatrician, the heads of the Department of Pediatrics. I'd say, I'm happy to come and talk to your hospitals. Some would say, well, we're kind of looking at things as a group, and you know, there was just 1 or 2 people that were holding out. But slowly we were getting it down. And, you know, when we were like 8 hospitals, I'd say you're one of only 8 hospitals out of all of Maryland's birthing hospitals that are still doing this. And then I'd say, oh, you're one of 6 hospitals. And so very slowly the hospitals started experiencing that peer pressure that we wanted them to experience, and they'd slowly get rid of it. And by the end of the summer of 2015, only 1 hospital was left. And sadly, that hospital actually closed its maternity unit in October of 2015, which is how we finally officially banned the bags, because they were the one holdout. So October 2015, officially we're bag-free. We're really thrilled. Excuse me. And there was some press, not as much as we'd like. It's always hard to find a reporter who wants to spread the word like we would like them to. But for example, in the Baltimore Sun, there was an article about Maryland hospitals stopped giving away free samples of formula to new mothers. Actually, we had, as a coalition, had put out a press statement with Public Citizens' help, and that wasn't really picked up. But when DHMH put out a press release about this, that's when they picked up the story. So having them working with us has been fabulous. So there was this, what I thought, a very nice article. Of course, like all of these news articles, they always have to have somebody quoted about, well, I still need my formula, or whatever. I don't remember exactly what the one person interviewed said. But, you know, of course, they have to end the article with some negative part to throw that twist in it. So a few days after that article, one of the reporters for the Baltimore Sun wrote an op-ed. And some of the quotes were, Maryland officials recently and rather self-righteously announced, and she explained about that. And she said, I'm all for getting rid of the swag bag. Hospitals shouldn't be marketing anything. But linking the decision to breastfeeding sends a message that formula itself is bad, piling on to the already enormous and sometimes detrimental pressure to nurse. Formula is not the enemy. The debilitating stress over the decision to use it is. And I got to say, this just floored me. I did not expect this. I knew there, some people thought that this was taking away, people's rights, but it really took me aback. And actually, about the same time, I was eating lunch with some of the staff in my office, and I work in a very low-income area, and our staff, also our medical assistants, come from the same community. And they pointed out the article, and they said, "Oh, Dr. Silver, is that you?" And I said, "Yes, it's me, and I'm really proud of it, and I'm so excited." And all of them had young kids, and some had breastfed, some had not breastfed at all, some had trouble breastfeeding and stopped early. They weren't working for my office at that time, or I would have kept them going at it. But what they said is, "Well, I went home and I had problems, and I needed that formula. What are you going to do? That's not fair. I can't get to WIC at first. That's not fair to the moms. You're taking away their formula, their right to have formula." And so it took a good 15 minutes of me talking to them about why this was, free advertising for the formula companies, why this was unethical, and then to really talk about how I'm so sorry their experiences were like that, because that's not how it should be, and what the failure was that we weren't supporting them, and that, that's an issue that we need to continue to work on, but that taking the free formula bags from these formula companies out of the hospital is not the enemy. And so it really, again, kind of put it into perspective that we really have to think about how we phrase things. So I wrote back to a letter to the editor about all of this. And I talked about why must society lay such judgment and morality on everything we do. As a pediatrician, I want to maximize the health potential of my patients. Among other things, I also recommend vaccines, car seats, eating fruits and vegetables, and exercising to my patients. And I see breastfeeding as just that. The author was correct in some aspects. We should not be zealots. I campaign to stop the formula discharge bags because it's an unethical way for formula companies to gain free advertising. But I believe that most mothers can attain success in breastfeeding without guilt if we as a community encircle them with the time, close follow-up, and encouragement needed. There weren't any responses to my letter to the editor, so I don't know. People said it looked good to them. But again, what really surprised me is how strong the response, how visceral the response was. So from the original article, there were lots of comments as well, as there often are. Again, just talking about how we are like the breastfeeding Nazis or other things. And it just really shook me that this, to me, seemed like such a no-brainer that we're providing free advertising for this company and it's unethical. But to so many other people, that formula in the hospitals has just been so ingrained as something natural. So it's something I encourage people who are still working on going bag-free to really consider when they're working on the campaign. So here are my lessons learned. Certainly peer pressure works. We really kind of focused hard on and it didn't take that long, just, every couple months I would kind of look and make a few calls or send a few emails. But that peer pressure works, of really whittling it down. Certainly, we acknowledge that a lot of our success was timing, building on DHMH program and momentum from other states. But free formula in hospitals have been around so long that people think it's normal. And Amy Resnick, who's part of our coalition, one of our former presidents, says, "We don't send patients who eat food home from the hospital with meals for the next few days." And it's a really interesting point, which is we're so used to sending babies home, moms home with the formula, whether they're bottle feeding or just in case there's problems with breastfeeding. But we don't do that with any other problem of people in the hospital. And then, as I said, really be mindful of how you phrase things, how you approach things. I think that that was just a real shocker. So what are our next steps? So bags are no longer distributed in the hospitals, but there are still those well-meaning nurses or others who will put a few bottles in the formula to go home in mom's bags, or other ways to undermine our confidence. We know certainly, "Oh, honey, you're tired. Let me give the baby a bottle overnight," things like that. So, certainly we know this is not making these hospitals baby-friendly. We know it's just one step, but we're hoping to change that mindset. The other thing, as you all know, is that formula companies have moved marketing bags to non-traditional locations. So I still get formula in my offices and don't get the bags anymore. I think I've really made my point to that one. Retailers, There's private radiology practices. When the women come in for their prenatal ultrasounds, they sign a little card and they get free formula and bags. So there's all sorts of other places that we need to raise awareness and really try to get those bags away. And we're going to continue to work with DHMH. Right now, we're awaiting for their most recent assessment to identify other areas to target. But you know, we're thrilled with the experience that we finally got through and accomplished this. But as everybody knows, there's still so much more to go. And that's my talk. Any questions?
Great. Thank you so much, Dana. And what a wealth of information, and just in the way that there are so many different strategies to use. Every hospital has a different lever that needs to its risk management. For some, it's like a bigger campaign to limit pharmaceuticals. So just so many great ways to do it. The campaign, you did a lot of good work developing the materials and having it on your website too, on the Maryland campaign website, your coalition website. So we have some questions here from folks. And you have a friend, Dana Valerie from MCV, saying hello. And then again, the big thing about pediatricians, you know, doctors do not know how to help mothers because, you know, your board exams have nothing on them about breastfeeding, or, you know, during peds rotation, often there is no mention of breastfeeding. And so there are folks like you who are bringing this to it. But, you know, your suggestions about how do we make this, you know, bring this more into the mainstream, have them on the exams, have questions on the exams, have breastfeeding be part during, not just during the residency, but even during the other years of undergrad, years of med school.
Mm-hmm. Yeah, no, absolutely. The AAP section on breastfeeding several years ago developed a fabulous residency curriculum that I know I've adapted for the pediatric residents at my hospital. I have encouraged the other hospitals with residency trainings in the city to adapt them as well. I like to think my residents come out better prepared than others. I think probably even more than the curriculum is just spending time with lactation consultants, which I really make sure our residents do. And then, yes, there is certainly a push in the American Academy of Pediatrics to get some of this education, and the Academy of Breastfeeding Medicine to get education into the medical school level of things. And OBs just came out with a statement about the importance of education in support of breastfeeding. So I'm hopeful that there is a momentum building there.
Right, and I'd like to put a plug here because USBC is convening these different constellation groups, and we have one that's dedicated to physician education, and we have, you know, members from a different, from AAP and American Academy of Family Medicine and, you know, ABM, all working towards to see how we might, you know, get curriculum and education into for students. So what were you, and I also wanted to say that Dana, from your talk, you see too that when there is a state backing for this kind of thing, when there's a state level campaign that happens, these initiatives you get a lot more momentum for these initiatives. So having either local or state campaigns that do. So did you, having champions over there are some things that coalitions again need to nurture for the states that are looking to do this from you? How would you, did you have to like work with your state Department of Health and Mental Hygiene to like convince them, or was the, did the interest come from the states?
Well, I think that the interest came from the states. Again, our secretary of DHMH at the time was a pediatrician, so that really helped, and a big breastfeeding advocate. But really, you know, our coalition actually originally was part of DHMH, and then we separated from them about 6 years ago, but we still have a good relationship, and certainly there's a lot of overlap of our members. So you know, it kind of went both ways. It came from them, but we provided a lot of supports and a lot of feedback. So it has been a very nice way to work. But you're absolutely right. You need that kind of push from the state to get hospitals really interested in moving.
Great, thanks. And is there some way for folks to access the Maryland breastfeeding policy that your hospitals are using, the statewide, 10-step policy?
I'm sure there is, and I could ask, I don't know if she's on the line, but Amy Resnick, who helped author that policy, can certainly get that to you. But certainly if you just Google Maryland DHMH Model Hospital Breastfeeding Policy, you'll probably find it. I don't think we have a link on our website right now.
We should be able to post, we should be able to post that for the group as well over here. Yeah. So we'll just.
It's very similar. California had something very similar. I know that they modeled a lot of it based on them. And again, it's also very similar to the 10 steps.
Terrific. And then how did the shift to not permitting the marketing impact the relationships for hospitals to get, new products, to get free products in, normal newborn or NICU? Was there pushback by the purchasing departments for when they had to start purchasing formula? What were some of those pushback forces like, if you experienced them?
Well, I can only tell you anecdotally some of the things that I heard. Most of the hospitals, again, if there was a higher up person that said it's done, then, basically they used up what they had and that was it. And they just didn't order more. But the hospital, the formula companies have their ways, and they'll give other things, and they'll say, oh, if you stop the bags, then you're not going to be able to get as much formula, or you might have to pay more for this. And so they find ways to kind of make people anxious or think that they're going to end up spending money. So, but I think, honestly, they started recognizing that this was not going to be working in a lot of these hospitals as the momentum built, because I heard less and less from hospitals as things went on. It was more from the administrators who were worried than anything else.
Right. Yep. That's the experience in other states as well. And some of the other state highlights are also like the kind of education and awareness that you did, writing letters, sending out educational materials, using your AAP platform to educate. Those are things that other states can really learn from you all, Dana. There, and then also where you can get like a broad base of media, where state coalitions have good connections with the media or with other organizations, like trying to get the broad base of support. So when you do have the kind of snapback of backlash, that there's voices and supporters who will also write in support of the efforts. So that's important as well. We hear from Veronica in Texas, Veronica Hendricks, saying that the Texas 10-step program, again, which is also a statewide initiative, with that in place now, over 85% of the 115 birthing hospitals have gone bag-free. So fabulous, Texas.
Wow.
That is a lot of hospital to go through. And then we have Teresa Landa from New York City saying that Maryland has a great WIC program, and she would want to know why you think doing WIC infant at bedside is good. I think having WIC do bedside breastfeeding assistance is great. So was it when you said that that WIC was at Maryland Hospital Birthing, were they there to give breastfeeding support, Dana? Was that what you were specifying, or was it?
Oh yeah. So I'm sorry. The question is about that one particular hospital that brought WIC into the hospital, or at the stakeholders meeting?
At the one particular hospital that got WIC, was it to give out formula, or was it to give breastfeeding support?
Oh, no, no, no. It was to give breastfeeding support and to enroll moms in the WIC. No, our WIC is very supportive, and actually up at that particular hospital, WIC breastfeeding coordinators actually help. They have a very large breastfeeding support group that meets, I think, twice a week, and the WIC breastfeeding coordinators for that area are actually the leaders of the group, along with the hospital lactation consultants. So WIC definitely wants more women breastfeeding, and when they were enrolling these moms, it's just that some moms are overwhelmed, and when they come home from the hospital, it can take them a week or so to get into WIC, and whether that's getting breastfeeding supports or whether that's getting formula if they need it, they found that if they could enroll them in the hospital with whether that's breastfeeding coupons or whatever it is that, or supports, then that seemed to help and take some of the anxiety off of the moms who say, I need to have something to go home with.
Absolutely. Thanks, Dana, for specifying that, just that it was, and we see that too, that those hospitals or those moms that can get enrolled in WIC easily get the kind of support. What you've said is really that the backlash that some of the moms feel too is not about that they don't have formula, is that there's such a paucity of that whole continuum of support for the mom when she leaves the hospital to be able to support, to breastfeed successfully. So we do have a lot of work to do. Veronica from Texas says we have 270 birthing hospitals in Texas and 115 are bag free. So there's still a long way to go, but great job, Texas. And I am going to now turn it over to, so thank you again, Dana, so much for this. I wanted to say before we close and move on to the updates that USBC has, again, has a constellation in formula marketing, but we also have learning communities. So for all of the states that are doing so much on Ban the Bags, as you know, Ban the Bags was a campaign launched in 2006 among the many other campaigns that are going on right now, but it grew out of the efforts of the Massachusetts Breastfeeding Coalition too. And we have the, baby-friendly hospital initiatives and of course, Public Citizen that we just sent you the link for. So please join the formula marketing learning community on the USBC website and share your stories of what you're doing around the states. We want to learn from you. We have other states who are just starting out and would love to know what's working, what has worked, and what other lessons learned. So if you haven't already joined the learning community, you can go to our website, click on the news and about, and then you'll see all the different learning communities connected with the action steps and more, and join the ones that you want to. But we hope that we will continue this discussion beyond this webinar and have you all join us and continue these efforts. So it's going to be time for our CDC updates, and I'm going to invite Kelly, if your audio is working. Kelly Scanlon is the chief of the NPAO, and if you can join us.
Yes. Can you hear me, Kinkini?
Yes, Kelly, we do.
Okay, perfect. Thank you, Kinkini, and thanks, Dana, for a fantastic presentation. That was great, great information. We have 3 short updates from Centers for Disease Control. First, I want everyone to know that the CDC 2015 Maternity Practices in Infant Nutrition and Care, or MPINC survey, is now closed, and it closed with an 82% response rate. So we want to thank many of you for encouraging participation in the survey. We still have a lot of work to do with the analysis, but we are planning to release individualized benchmark reports for all participating facilities, as well as state reports by fall of 2016. A second update is that currently 340 U.S. birthing facilities in 49 states are baby-friendly designated. increasing the percent of U.S. births at a baby-friendly facility to 17% of all births. So we still have a long way to go, but that is quite an increase from just a few years ago. 72 of the baby-friendly designated facilities are among the 89 Best Fed Beginnings hospitals, which was a CDC-funded initiative with the National Institute for Children's Healthcare Quality. And as a third update, I want you to know, as many of you know, CDC is very involved in the Zika virus response, that 2 members of our infant feeding team have been contributing to the Zika virus response. Our Epidemic Intelligence Service Officer, Jennifer Nelson, served as a pediatric subject matter expert for the clinical inquiries team and contributed to CDC's interim guidance on breastfeeding in the context of Zika, among other publications that have just been released. And our senior scientist on the team, Rosie Lee, participated in the World Health Organization meeting on breastfeeding in the context of Zika. WHO is reviewing all evidence for the development of recommendations on breastfeeding. And those are 3 updates. And please let me know if you have any questions.
Great. Thank you, Kelly. And thanks for all that good news about our the progress. And as you can see, that when you have the momentum behind nationwide initiatives like Empower and the NICHQ Best Fed Beginnings and all the other state level, it really has been moving the needle, as we've been seeing. And you should have seen CDC's resources on Zika and the Wednesday Wire as well. So we will keep you updated, and we are sending it through our different communications channels to the coalitions as well. Thank you, Kelly, for that.
Great.
Moving on to USBC updates, be sure to join the Coalition's Learning Connection. We send you a lot of good, relevant weekly news updates. So there we are team headed by Communications Coordinator Lynette Corralson collects so many good resources, and some make it to the Wednesday Weekly Wire, but there are many that we can't put in because we have to keep the wire short. So we do share it with through the different channels. So if you join the Learning Connection, you'll be able to get a lot more of the news that's there. So thank you for those states. We sent out the leader survey, the Coalition Leader survey. And we have 42 states that have completed the leader survey. So for those 7 or 8, you might be one of those that haven't done it. It just takes 15 minutes, and it gives us a lot of information about, you know, what you're doing, how to connect you, how to involve you in the different initiatives that are happening, but also how to plan our training and capacity building support for Coalition. So please do complete that survey if you haven't. And our last update is about the National Breastfeeding Coalition's Conference, which is going to be from August 5th through 7th in Arlington, Virginia. So our calls for proposals, we got a bunch of great abstracts, and our proposal review committee is working hard going through each one of your abstracts. We did the proposals are still open for table topics, for posters. So for all of you who are doing such amazing work out there, we hope you will continue sending proposals for those. The ones for breakfast table topics and posters close on May 2nd. And we will be having pre-conference workshops and sending you information about that. You should have seen an announcement for tribal scholarships. Thanks to funding from the Kellogg Foundation, we'll be offering a small number of tribal scholarships. So if you have folks from Native American communities, breastfeeding advocates, please do share the information we sent about the tribal scholarships to this conference. And well, that brings us to the end. And thank you again, Dana, for that terrific presentation. I know that we will be directing people to the Maryland site to get all the good stuff that you all created for your campaign. So until next time, thanks again. for all you do, and we will be back with you on this series in June. Goodbye.